Hi, my name is Abeer AlMajali, and I'm one of the infectious disease doctors at the University of Illinois College of Medicine in Peoria. I'm going to talk about COVID-19 and diversity. Across the US during the COVID-19 pandemic, Hispanic and Black Americans were disproportionately affected by higher rates of hospitalization and mortality. Unfortunately, according to many polls, they were also less likely to get vaccinated once vaccines became available to them. These racial disparities in the number of COVID-19 infections can be explained by a number of factors, including involvement in frontline jobs, limitation in personal protective equipment, which would make social distancing more difficult and increase the amount of occupational exposure. Moreover, racial inequities in terms of access to healthcare would explain the increased mortality in Black and Hispanic American populations. This includes both the acute limitation during a COVID-19 infection and chronic limitation in access to healthcare, which has resulted in many poorly controlled chronic conditions, which we all know now increase your risk for COVID or severe manifestations of COVID-19 infections, including diabetes, obesity, or high blood pressure. Here at the University of Illinois College of Medicine at Peoria, we recognize the presence of these racial, ethnic disparities and are working to curtail their impact on our community. The most immediate way we can all limit the effect of these disparities, at least in a COVID-19 setting, in addition to wearing masks and social distancing, is vaccination. At this time, we have 3 vaccines available in the US, all of which have been extensively studied and to ensure both their efficacy and safety in clinical trials that included people of different backgrounds. Over 38 million people have been fully vaccinated in the US so far. While initial polls may have showed a hesitancy towards vaccination, especially in our more vulnerable populations, this hesitancy is becoming less and less prevalent as more people are getting vaccinated with no to few serious side effects, and as people are gaining more and more access to information in regards to these vaccinations. We encourage everyone to get vaccinated once the vaccine becomes available to them. We also encourage you to reach out to your doctor with any questions or doubts you may still have in regards to these vaccinations. While getting vaccinated is great in reducing your own risk and that of your loved ones who may be at higher risk of developing severe disease, it is also the first step towards a normalcy we have all been craving. So while there are bigger factors in play that may have resulted in these unequitable outcomes, there are a few manageable ones that we can all control. Vaccination and masking and social distancing while waiting for enough people to get vaccinated are those factors. Thank you.